All right, Shannon, thanks. We asked you for your common questions about sleep, and this morning a doctor from Brigham and Women's Hospital is going to help answer them. She also looked at me like I had 3 heads when I showed her all of my sleep supplements. Isn't that right, Dr. Milena Pavlova?
Yes, I did.
Now, out of these, one of the ones that you think is the most logical is the melatonin. Tell me why you like that.
So the reason why I favored melatonin was because it's a natural hormone that we secrete during sleep. It helps our body know when is our biological night. This is the signal that our body uses to indicate it's the biological night.
So you like that one?
It has been, it has been used in jet lag relatively successfully. Multiple studies have used it for insomnia and have shown inconsistent results simply because the reason for insomnia, the reason not to be able to sleep varies among individuals.
Well, that's my sleep question answered. Thank you so much for that. Let's get to a couple of the viewers now. I understand, I think we have the first question is from Nicole. She says, I go to bed at 9:30 p.m. I'm still wide awake at 11, and I still wake up throughout the night. This happens to a lot of people where, you know, you say you need a good night's sleep, so you go to bed early, but then you can't sleep. You're tossing and turning, and then you're kind of restless. What do you recommend for something like that?
It's impossible to give a one-size-fits-all answer to this. The reason not to be able to sleep can vary very vastly among individuals. I would start by regulating not just the time when someone goes to sleep, but also the time when they wake up. Because the time when you wake up and you open your eyes and light gets into your eyes is the time when your biological morning starts. And the activity during the daytime is one of the things that creates a gradient to allow for our body to relax and enter natural sleep. If we are passive during the daytime, take several naps, especially if those naps are late in the day, that can contribute to poor sleep.
Let's talk about shift work, because Becky also wrote in. She says that she works the midnight shift. She wrote us on Facebook saying, I'm tired, but I can't sleep after 12 noon, which is, you know, probably when she would be natural for her to go to sleep so she could get 8 hours. But then she goes back to bed at about 7:30 or 8 p.m. and she still has trouble sleeping. When it comes to shift workers in particular, it can be very difficult to fall asleep at the time where you know you may be tired, but your body is telling you, no, it's daytime. Why are you sleeping?
That is correct, yeah. Again, it's difficult to give a one-size-fits-all approach. For some people, it is a little easier to change the time of their sleep relative to their circadian timing. For others, it's more difficult. Probably the best overall approach is to have the time of sleep on days off to be similar to the time of sleep when you are working, and I know that can help a little bit. That
can be difficult if you're working the midnight shift. But what do you think about, a lot of people ask this, about splitting up your sleep? So when you first get off of work, taking a nap for a few hours, then staying up and then going to bed.
That's the next best approach. Okay. Yes, that's the next best approach. And for some people, pharmacological means are also helpful. And in those cases, I would ask a doctor.
We have another question from Nancy Lally. She says she has trouble falling asleep and also staying asleep. She's tried all the suggestions that are usual. She goes to bed at the same time, she wakes up at the same time, she exercises, she still works part-time. She doesn't take any caffeine, and pretty much every woman I spoke with has the same issue. She says, I'm always exhausted. This is so frustrating, and I know that we had the author of a book, Tired and Wired, come on the show, and she talked about the fact that a lot of times you're busy throughout the day, and there's never a time where you're running so fast, or you're doing so many things, or you're fitting so many errands in, that you never actually feel relaxed enough to fall asleep. Could that be the issue?
That could be the issue in some people. They just run at 100 miles an hour, and at some point they can't switch off. And that's the problem a lot of people have. Another issue, especially in women, I don't know how old the viewer was, but especially in menopause, or even before menopause, 40s and beyond, various disorders become more prevalent, such as sleep apnea. Often people think of sleep apnea when they see a man, but actually this is a condition that can also affect women, and the frequency becomes much higher after the age of 45, 50, and especially after menopause.
When there's hormonal changes
hormone changes probably contribute to this. And there are other conditions. Restless leg syndrome is another one.
So it sounds like since one size doesn't fit all, you should just go and see your doctor if you have any questions.
Absolutely. You should see your doctor.
Dr. Milena Pavlova, thanks for joining us this morning. Joy, over to you.
Okay.